I think what's going on is that COVID is losing its pandemic flavor here. It's still a very important infection, as we'll come to in a moment. So overall this year, COVID is still beating influenza in terms of number of deaths. It's a macabre conversation to have, but it's still a serious issue. So direct and indirectly related to about 1,800 deaths so far this year. That's a lot of deaths, but flu is not that far behind. And in August, as you say, flu overtook COVID-19. Now that's the first time since the pandemic began. So you might remember when we go back to the pandemic, in January of that year, it looked like being a really bad flu year. There were a lot of flu cases in January of 2020, and then it disappeared as people stopped circulating around the world. But now it's back with a vengeance. And so the message here is that both are important. But also what seems to be happening is that COVID is falling into a pattern where there's a rise in over Christmas, and a rise in early winter as well. And that seems to be happening overseas as well. And it could be that we're just getting into that seasonality. Flu is a seasonal infection. COVID hasn't been. And it may be that we're settling into a regular pattern with COVID, which again takes it away from this pandemic idea, much more of an endemic virus. But that doesn't mean that it's not a serious virus that needs to be taken into account. 1,800 deaths is a lot. And that means there's a lot of people in hospital. Not as bad as it was. You know, a couple of years ago, there was 4,000 odd deaths. Now it's down to this, which is about background immunity. It's about having the immunization. And it's also about the virus adapting to us and becoming less aggressive.
I mean, it's important not to be complacent around all of this, as you just mentioned. Tell me about this study into 3-year-olds whose mothers contracted COVID or caught COVID in pregnancy.
This is a US study of women who are pregnant between 2020 and 2021, so right in the middle of the pandemic, and where there was no vaccine available to them, and that women who got infected with COVID, as proven by PCR testing, their kids had about double the chances of, at the age of 3, of having developed a neurodevelopmental problem. So that's it probably, you know, things like ADHD and autism spectrum disorder. So it jumped from about 8 or 9% to about 16%. 16% is a significant number. And it illustrates why pregnant women need to be immunized, not just against COVID, but influenza. Both infections are bad for you and bad for your kids. Now, this is not to generate panic, but it means that you do need to get immunized during pregnancy. Don't take this for granted. Don't be complacent about COVID. It's still around and it still can be toxic.